I'm Paolo Casali. I'm a medical oncologist working in Milan at the Istituto Nazionale Tumori. Yeah, I'm talking of rare cancers, which are a distinct group of rare diseases, if you want, but there is a strong distinction between rare diseases and rare cancers, because rare cancers belong to the world of oncology, of course. So they are rare, but at the same time they belong to one of the most common diseases. I would say that from the regulatory point of view, the main difficulty is, of course, that when the numbers are low, the quality of evidence may be suboptimal in comparison to common cancers. And so, from the regulatory point of view, this may mean that there are more difficulties in the development of new drugs. And we always say that in rare cancers one should accept, also from the regulatory point of view, a higher degree of uncertainty, because otherwise rare cancer patients are discriminated against by definition. I think we should build a consensus between the clinical community, the patient community, and the regulators about which are the rules in rare cancers. Because anything able to decrease the uncertainty, so the regulatory uncertainty, may substantially improve things. The regulatory uncertainty may be something preventing a company from developing. I mean, even more than, I don't know, the limited market, for example. So the orphan drug regulations are very effective, may be very effective, but most of the incentives they foresee apply only if the drug is approved. If the company perceives that the regulatory uncertainty is too high, so the regulatory risk is too high, it may decide not to go ahead. I would say something which has been attempted in rare cancers is to share the knowledge about the rare cancer, the single rare cancer, with the regulators. Because sometimes some decisions, some regulatory decisions may be made because of a lack of knowledge by the regulators about a disease, especially if it is a very rare cancer.
Perfect, thanks. And in Italy, I know that there is this group of rare cancer. Is it working well? Were they able to implement?
In Italy, we are trying to build the Italian Rare Cancer Network, which is a healthcare network, which clearly wants to improve quality of care by sharing clinical cases among oncological institutions. But I think that networking could be exploited also from the regulatory point of view. Because, for example, I don't know, a reasonable degree of off-label use of drugs in rare cancers may make sense within a network. So may be rational, may be cost-effective, and so on. So I think that there are many ways by which healthcare networks could be exploited also from the regulatory point of view. Of course, beforehand, you need to build these networks, and you need to have them in place and well in the life.